Hi there! Welcome to another video in our on-demand education series. I'm Shelby Riles, and I'm with Community HealthWorks. We're a nonprofit organization working to make Georgia communities healthier. We have an emphasis on cancer prevention and promoting healthy living. So the focus of this video is going to be colorectal cancer. We're going to discuss some statistics that relate to it. We're going to discuss risk factors, screening options available to you, as well as signs and symptoms. So let's dive right in. Cancer is exactly how it sounds. It's cancer of the colon and or the rectum. It's also considered the large intestine, which is the very last part of your digestive tract. When food enters the colon, water gets absorbed and the food residue is converted into waste, which you know what happens with that. The rectum is the terminal part of the colon. It's the ending piece. It's the piece you see here at the bottom there. Polyps can form on any portion of the large intestine, whether it be the colon or the rectum, and either is termed colorectal cancer. That is, if it's cancerous. It could be a benign lump that could form, which is fairly common in people over the age of 50. But certain types of polyps can develop into cancer, and they should be removed if they are detected. And that's through a colonoscopy, which we'll talk about later. Colorectal cancer is the second leading cause of cancer-related deaths. It's only behind lung cancer. In 2021, colorectal cancer claimed 53,000 lives. And in the same year, about 150,000 people were newly diagnosed with colorectal cancer. Now, that number of deaths is shocking, considering colorectal cancer can be detected early. It can be taken care of early. So please hear me out when we get to the screenings portion. 1 in 3 people are not up to date with their colorectal cancer screenings. So I hope that after this presentation, you'll not be part of that 33% of people that are not up to date. Make sure to schedule it today. So you've already heard me mention screenings, and you'll also notice that I'll say colon screening, colorectal cancer screening. The same thing is what I'm talking about. So when you turn 45, that's when you should schedule your first preventive screening. How often that you get those screenings done is going to depend on 1, which screening method do you use, and 2, what's your personal risk for developing colon cancer. So what's going to be things like what's your family history, what's your personal history, what are your personal risk factors, those kinds of things. I like to preface discussing risk factors by making the disclaimer that absolutely anybody can develop colorectal cancer. Me, you, anybody. And so that's important to keep in mind that if you don't personally have any of these risk factors, it doesn't mean that you can avoid getting your screenings done. Everybody should be getting screened for colorectal cancer at the age of 45. In general, these are the risk factors for colorectal cancer. We've already mentioned that screening should start at age 45, and so the reason for that is because that's typically the age group that we start to see colorectal cancer. It's not to mean that if you're younger than 45, you absolutely can't get it, but it's most common in ages 45 and up. So that's why it's important when you turn 45, call your doctor, get your colon cancer screening scheduled. The second risk factor that we like to talk about, and this is in general for all cancers, but we notice for colon cancer really especially, is that drinking alcohol can really have an adverse effect on the body and on the digestive system. That's not to mean you can't drink any alcohol, but indulge in moderation, balance having fun with your physical health. In general, doctors recommend that women should have no more than 1 drink a day and men 2. And that's if you're somebody that's doing this daily. The other piece of information here is that smoking kills. That's whether you're using a vape, cigarettes, any form of smoking, inhaling, burning a substance and inhaling that. That increases your risk for developing cancer, any cancer. Most people think it's just lung cancer that really will affect, and that's just not true. Colorectal cancer follows only behind lung cancer, as we previously mentioned. Eliminating smoking from your habit decreases your likelihood of developing cancer in any sense dramatically. Talk to your doctor today about quitting methods that would work best for you if you're somebody that does smoke. We completely understand that that's not an easy habit to kick, but it is really important to do so to take care of your health. If you're not somebody that exercises a lot, that's another risk factor that we see will increase your risk. So incorporating some physical activity into your life is going to be really good for you. Doctors recommend that you should get about 30 minutes of exercise a day. That could be a brisk walk outside, a power lift at the gym, a short yoga session, whatever it is that you enjoy to get yourself moving. And it doesn't have to be an activity to dread. In fact, exercising releases hormones into your bloodstream, such as endorphins and adrenaline, dopamine, and those are associated with the feeling of happiness. So make sure to get some exercise into your lifestyle. Of course, eating well is so important. We're talking about cancer in the digestive tract, specifically the large intestine. If you have a low fiber diet particularly, you get more increased risk of colorectal cancer. We got to think, what does fiber do? Fiber helps move things along in our digestive tract. So if you're not getting a lot of fiber, you're probably not getting a lot of movement, and you're having more, let's just say, issues when you're in the restroom. So just make sure that you're getting a variety of fiber into your diet. Make sure you're getting your whole grains. Make sure you're eating your fruits and veggies too. That's, of course, going to be very good for you. The next piece is also in line with that. It has to do with weight. So that's kind of in line with the other two. Just in general, if you're somebody that's overweight, you're at an increased risk of developing cancer. And colorectal cancer is one of those as well. So it's just something to be mindful of. Work towards a healthy weight if you're somebody that does not have one. This slide is a continuation of the last one. I want to reiterate that personal or family history of colon cancer is probably one of the most important risk factors when we talk about colon cancer. It's a huge factor when considering any disease. So yeah, just want to reiterate that. And then I also want to reiterate the personal history of IBS, things like that. Those are going to put you at an increased risk. So that's something to also talk about your doctor with. I like to include this slide just to give you an idea of what the different stages of colorectal cancer are. As you can see on the bottom there, it says that the goal of a screening is to detect cancer early, before you have any symptoms. So as you can see from this diagram here, as we move from stage 0 on to stage 1, 2, 3, and then 4, we have increasing amounts of cancer, whether it be localized, whether it be spreading, or whether it be metastasized. And so the sooner that we can detect cancer, the better it is, as you can see here. We really don't want to be detecting it too late, because the earlier you detect it, the better it is. So this is the part of the presentation that I get most excited about. We get to talk about screening options. So there's two main types of screenings. There's the stool-based test, and then there's, of course, the colonoscopy. So when you turn 45, you should be doing at least one of these. And let's get into the details. The first stool-based test option that we like to talk about is called Cologuard. What Cologuard does is it looks for DNA in a stool sample that you provide and send to a lab. They assess your sample for if there's DNA in it, and specifically DNA that is, wrong, kind of broken. You can kind of think of it like that because that indicates cancer. And Cologuard is non-invasive. Like I said, it's a stool test, but there are pros and cons to each of these. And it might initially look like, oh my gosh, the cons list is just so large when it comes to these stool tests, but Let's get into that. So Cologuard specifically has higher rates of false negative and false positive results. In general, a stool-based test does not give you any visual inside the colon or the rectum. So if you have a positive result, you're going to need to have a colonoscopy. And Cologuard is more expensive than the other stool-based option that we're going to talk about. The pros of Cologuard are that it's non-invasive, you can do it at home, and you only have to do it once every 3 years. So Cologuard is one option for stool test. The second option for a stool-based test is called the FIT test. And the FIT test is generally what we at Community Health Works encourage to be your screening method. And so it's a lot like the Cologuard test in that you take a sample, it gets sent off to a lab, but instead of looking for DNA, they're looking for blood, because blood is another indicator of colon cancer. So FIT has some false positive results. Like any stool test, it doesn't give you any visual inside the colon or the rectum, so because of that, polyps and other abnormalities may be missed, and that's a standard for a stool test. Like Cologuard, if you get a positive result, you're going to need to get a colonoscopy. And the thing with FIT is that you have to complete it every year. The pros are that it's non-invasive, that it can be completed at home, and that it's cheaper than Cologuard. FIT test is the cheapest option for getting your colon screening. Now, a colonoscopy. It's an efficient screening method because when they go inside and physically look at what's going on, they can actively go ahead and remove any polyps they might find. So that's why a colonoscopy, it looks like it has so many more pros. It's because it's invasive. It's because they go in there and then they remove anything that they might see that's abnormal, and then that can be biopsied to determine if there's cancer. And a colonoscopy can also determine if you have other things going on, like hemorrhoids, diverticulosis, some things like that. And it's covered by insurance, as should the stool tests be, and it's completed every 10 years. So once every 10 years, and that is, of course, if you are at normal risk for developing colon cancer. If you're at increased risk due to family history or some other factor, you're going to have a more frequent screening timeline. And the cons of a colonoscopy are that it is an invasive surgery. It requires sedation. It requires that you do a bowel prep. And it's time consuming, so it requires a chunk of your time to schedule an appointment, have a pre-op, go have a colonoscopy. It's a significant amount of time. The last main thing that I want to talk about on this presentation is the signs and symptoms of colon cancer. So as you can see here, these are some of the examples. You might have trouble going to the bathroom. You might have blood in the stool. Like we said, a FIT test would look for that. You might have unexplained abdominal pain or unexplained weight loss or loss of appetite. You might have be tired, unexplained tiredness. In general, though, you'd be looking for like persistent bowel habit disruption, including things like prolonged diarrhea, constipation, consistent change in the consistency of stool, among other things. But in general, those habits, looking for if things are weird, feeling how you feel if something feels off, you feel pain, something like that. Those are the signs and symptoms. So we've reached the end of our presentation. I want to reiterate that on the screening slide, it seems like colonoscopy is immensely better than a stool-based test. And to some degree, that is correct, because a colonoscopy, like I said, is an invasive procedure where they can go ahead and remove cancer if they detect it. But stool-based tests are a lot easier to do. You don't have to do any colon prep, it can be a not very pleasant experience. And with the FIT test specifically, you can do that every year. They look for blood. It's pretty standard, and that's why that's the one we recommend and encourage, just because it's also a lot cheaper. But in general, I want to say thank you so much for watching this presentation. It means so much to me to have you here. And to reiterate, I'm with Community Health Works. We're a nonprofit. working to make Georgia communities healthier. You can see our website here, access our social media, and feel free to leave me any questions or comments on this video. And I hope you have a great rest of your day.